Thanks for tuning in for another episode of our series of CIRP's mental health webinars. Enjoy and let us know your thoughts in the comments below.
Sure. Is there any information on how COVID is impacting mental health?
So Vicky, the question is there any information on how COVID is impacting mental health?
So there's no information has come through as yet. It's too early. There's not enough data right now to have any numbers and stats around how or to what degree COVID is actually affecting people's mental health. However, I think what we do know is that it is impacting people's mental health for sure. Certainly anecdotally on the program, we know that we are hearing from our clients. So our counsellors are hearing on a regular basis that COVID is very much affecting mental health in a negative way. So what they're finding, what our counsellors are finding is that it's leading to a lot of anxiety and a lot of stress. It's the uncertainty, it's the unknown. What we also know is that it's not just CIRP, it's other agencies as well. We know that just about every organisation, they've been hearing from their audience or their members, their participants, that there are issues with mental health around COVID. So if you go to, for example, the BC Centre for Substance Use, you'll go onto their website, you'll see some information there around how to cope with mental health during COVID. If you go to CAMH or if you go to CMHA, those organisations, they're also talking about mental health. And in fact, even our own industry organisations, so you've got the BC Centre for BC Construction Safety Alliance, WorkSafe BC, all of these organisations, they are also recognising and they're hearing from our members that mental health is really being impacted by COVID. And so if you go onto their websites, you're going to see that they're also talking about this. So I think whilst we don't have any hard numbers as yet, and whilst we don't have any data that's come up currently, we do know that the conversation is definitely already happening. People are already talking about the impact of COVID on mental health. Yeah.
Awesome. Thank you, Vicky. And also, what general things can women do to improve or maintain good mental health?
So Vicky, the question is, what general things can women do to maintain good mental health?
That's a good one. I think that the first thing to really understand is when we're talking about mental health or poor mental health or a downward turn in mental health in relation to COVID, one of the things that comes up most often is anxiety. Anxiety is something that people are really struggling with. And when you can understand anxiety, you begin to understand why it's really escalated during COVID. Anxiety as a concept really does work on the unknown. So when people are worried or have what we call worry thoughts around something where the outcome is currently unknown, that can trigger anxiety for people. And so for the fact that with COVID, there is so much unknown. There's so many things we don't know about COVID. Everything's evolving. It's a brand new virus that we weren't aware of before. And so because there is just this sea of unknown, this can create a lot of worry thoughts. So worry thoughts are things such as, what if, or what if it can't be resolved? What will I do if? And there's all these different scenarios. So for that reason, we're seeing a lot of anxiety. So one of the things that you can do if people are experiencing anxiety, and one of the strategies we employ as clinical counsellors, is to limit some of those worry thoughts. What I'm hoping is if maybe some of the audience that are watching today, if they can talk about or maybe even comment about some of the worries that they're having, and we can actually help with some specific examples. But in general, if you have a worry thought, so one might be, what will I do if I contract COVID? How will I cope? And so with worry thoughts, there's an expansion of these worry thoughts. What if I go out and I can't cope with what's going on? What if I go out and I contract? What if I contract this and it gets worse? What if it gets worse? How will I cope with that, or how will my family cope with that? And so it's this expansion of worry thoughts. So when we are looking at anxiety and how to manage anxiety, one of the things we want to do is to stop that expansion. It's when it's okay to worry. There's something, there's a healthy amount of worrying that we can do, and worrying can actually have some useful elements, so long as it doesn't snowball into layers and layers and ripple effects of worry. And so one of the things people can do is really be mindful of the types of worrying that's going on in their mind. If those worry thoughts are really expanding out, or if there's a lot of expansion of those worry thoughts, that can really lead to anxiety. The other thing you can do is when, as I said, with anxiety, it really does, as a concept, rely on the unknown. If there's a lot of unknown, anxiety can develop. If you know what the outcome is, or you know a lot of information about the topic, you're less likely to have anxiety. So with that in mind, if people are really feeling anxious about COVID, one of the best things that anyone can do is actually go out and seek the facts. Seeking facts is really super important. And also, I think one of the other things that we should be mindful of is that within what we're seeing is a lot of misinformation. I'm sure everybody out there has had the WhatsApp messages or the Facebook messages that said, if you, I don't know, if you drink lots of hot water and have lemon juice, that you can kill the virus, things like that. So knowing where you can go for facts and factual information, that can certainly help with anxiety. That can help ease some of those worry thoughts. So facts like, where do I need to go for the right information? So that might be, for example, the BC Centre for Disease Control, so the BCCDC website. That's a fantastic place to go. The government websites, they're really good places to go to get factual information. And also, for yourself, have a plan. Have a clear plan and outline so that you are, again, reducing some of the unknown. So that is the where, the what, the when, and the who. So who am I going to contact if something goes wrong? Who should I speak to if I'm worried about things that are going on in the family? Be clear, have a strategy in place. And so having that kind of structure can help reduce the anxiety, because you're controlling some of that unknown. The other thing that we know is that there's very, very early anecdotal data that's coming in. It's not, we don't have the stats yet or the numbers, but anecdotal data that's coming in is showing that actually Canadians, more than COVID itself and getting sick, what Canadians are really worried about is the financial impact of COVID. So again, that can create a lot of anxiety, and some of the strategies that we can employ to reduce some of that anxiety around that is to know, again, where can I go to get information about financial assistance? What can I do? What am I entitled to? And I always recommend actually writing things down on a bit of paper, writing it down, being very step-by-step process, so that you know that if something should happen, here's where you go for the information. Know what's available to you, what benefits are available to you. Speak to your lenders. Like I said, financial stress is one of the biggest stress that's arising right now. So talk to your lenders, figure out what a plan is should things go the wrong way, should things get really difficult. Having a plan of what to do or where you can potentially go can help bring some of that anxiety down. And the other thing, part of this is self-care. Self-care is something that we talk about a lot in mental health. We often talk about strategies that can help recharge you, re-energize you. So if you think of ourselves, our emotional capacity as a container, when we are under stress, when we have anxiety, or when we have other mental health issues, what happens is that container of our emotions or our wellness or our coping capacities, it starts to deplete. And so what we have to do is actually do engage strategies that help to fill that container back up. And so one of the things that has been shown to work, there's a lot of evidence for it, is mindfulness. Mindfulness has actually been shown to change the neurochemistry of the brain. So I've got to be honest, when I first started in this field over 20 plus years ago, mindfulness was something that I didn't really buy into. I was like, oh, it's too hippy dippy for me. I'm too much of a scientist. It wasn't something that I bought into. However, as I did my research, as I tried to kind of understand this a bit more, I realized very quickly there is a ton of evidence, hard factual evidence that shows that when you practice mindfulness, you actually change the neurochemistry in the brain. You can actually change the way that your brain is structured. It changes something in the way, we call it neuroplasticity. It changes the way that your brain is actually hardwired. So practicing mindfulness is a fantastic way to help with improve mental health and to manage and bring down anxiety. Mindfulness is not something that's the easiest thing to practice, but luckily we live in an age where there's a gazillion apps, so you can download often, many times, tons and tons of, there's loads of them out there, free apps. And those free apps can help you guide you through mindfulness, and they can guide you through the steps of mindfulness. The thing to remember with mindfulness is that it's like anything. It doesn't work the first time because it takes practice. Any skill that you are developing, anything that you're learning that's new, it's really important to practice it. And it takes a bit of time to get the hang of it. It takes a bit of time to get to the point where it's where you feel really, really comfortable with it. And so mindfulness, just be aware that it takes a bit of time to practice, but it's one of those things you can get into very, very quickly.
Awesome.
Okay, Vicky, if I can interrupt you here for a question.
Mm-hmm.
So we've had a question from a participant asking, when is it time to contact your doctor about depression and anxiety?
That's a really good question. So anytime any mental health issue is beginning to interrupt your life, when it's been going on, when a pattern of mood behavior or mood changes have gone on for more than, I would say, probably about 4 to 6 weeks, you definitely want to go in and speak to a mental health professional. And the thing to remember is mental health, it runs on a continuum. So we if you imagine from here to here, we don't go through life where mental health is always up. There's times where it will ebb, it will flow, and it goes up and down. And that's normal. We have things that happen in our life. In fact, it would be abnormal if something was to happen in life. You had a negative event and you wasn't feeling sad or depressed about whatever had happened. That would be abnormal. So it's okay to have these ups and downs, and they're very, very normal. But in our field, what we're really looking for are these pervasive mood changes that are happening for extended periods of time. That's when you really want to go and speak to a healthcare professional. We want to, and if you're finding it very difficult to kind of lift yourself out of that downward spiral, or even if it's just a low mood that you haven't been able to shift for a number of weeks and you're doing all the things that you normally would do. The other part of this is when there's sometimes poor mental health is something that we are just used to living with, so we don't actually know that it's different to anything else. So how do you know it's different if this is just your normal or it's just your baseline? So then you have to look at different indicators. So then in that case, I'd be looking for things like, do you find that you no longer are enjoying things that you used to enjoy? So although you may not notice that your mood is low or that you're feeling more anxious because it's just become the new normal, but it might be, you might want to look to other things. So, is it that normally when I used to call my friends, I'd actually really feel energized, or I'd feel really good when I spoke to my friends. Now I notice that actually when I speak to them, I don't get that same joy out of it. Things that used to give you a lot of joy, it might be going for walks or playing with your children or going, socializing or taking the dogs for a walk, and suddenly you're finding, or you notice that actually I didn't think my mental health had declined, but I'm not having the same joy as I used to. So they're good signs to know that there might be something going on. And in those cases, I would definitely recommend that people go up and speak to professionals. And the other part of this is to remember who do I speak to? Like, who is the correct or the right person to be speaking to when I notice this? I think physicians are always a good place to go first, because it's important to kind of check that there's nothing else physiological going on. And the other part of this is to remember that you can go there, but that really you want to go to a mental health professional as well. So I would recommend going to both. So physician first, and making sure that there's no physiological underlying issues that are going on, and then certainly seek out some mental health clinicians.
Awesome.
I hope that answers the question.
Thanks, Vicky. I don't see any. Do you have any suggestions for mental health apps that you particularly like? You mentioned earlier that you like.
I've lost audio, I think. Nicole, are you there?
Yep, I'm here. I think it's because you can't hear Ashley, so she's asking you a question.
Okay.
No, I was just asking if you had any specific mental health apps that you would suggest. You mentioned before that you, with mindfulness, that you like using apps and things like that. Do you have any that you prefer?
So the question is, do you have any mental health apps that you prefer using? So you mentioned before that with mindfulness and mental health, you like to use some application or apps on your phone. So if you have any recommendations, there's also a question about that as well.
Mm-hmm. So I didn't come prepared with a list, but I know that my counsellors for sure, they have a list of apps that they use. Headspace is probably the most well-known app. Unfortunately, I can't remember if it's a free app or you have to pay something. I believe if you do have to pay for that, it's not one of these very, very expensive ones. It's very reasonable. However, I do think it's free. So Headspace is probably the most useful one. It's great because what it does is you can set reminders. So you download the app, you set the reminders, and the reminders are to actually go through a mindfulness exercise, and it will walk you through it. And so if you've got your headphones in, or if you're just listening to the regular audio, it'll talk you through some of some really good mental health exercises, some good mindfulness exercises.
Awesome.
I'm sure what we can probably do is, Nicole, if you make a note of that question, we'll see if we can get some recommendations from our counsellors, and we can maybe put down some of the most common and most useful apps that we use, and some of the ones that our clients recommend as well.
Yep, absolutely. Another question we've had is, any advice for irritability?
For sure. So irritability, the first thing to understand is when someone is feeling irritable, it's actually a symptom of something else that's going on. It's this what we call a secondary emotion. So it's not a core underlying emotion. It's a symptom of something else. So mindfulness, and you're probably going to hear me talk a lot about mindfulness, mainly because it's been recommended by the World Health Organization. All the data shows it, the research shows it, that actually mindfulness is probably the number one strategy anybody can use that actually helps to bring any kind of distress down. It's very, very effective, extremely effective. So if there is irritability going on, first off, remember that if there's irritability going on, it's a secondary symptom. It's a symptom of something else. It's a good indicator for you that there's something else going on. So I would be looking at maybe looking to implement mindfulness. The other part of this is, if there's irritability going on and we recognize that it's a symptom of something, it means that we might have to do a little bit of digging. We might have to have a look underneath and say, okay, what is going on for me? What is it? Is it that I'm afraid of what's coming up? Is it that everything has just got on top of me? If you can start to peel away, if you can start to look at those layers and say, okay, where am I classifying this? Is it because it's based in fear? I'm worried about what life's going to hold for us with regards to COVID, or even another issue? Or is it because I'm just busy, I'm constantly busy, and now I'm just not taking care of myself? Each of those has a different solution, so it's important to start seeing if you can figure out what's going on under that irritability. sometimes it's very difficult to figure that out, and you try and you can't, in which case I would say it's useful to go and see a mental health professional, even if it's for a short period, just to see what's going on underneath and help you figure that out. And mental health professionals can probably do that in a very short period of time, so it's not like you're seeing them for years and years and years, but just to figure that out. If you figure this is because you are feeling like you've got too much on your plate, I would recommend maybe increasing your self-care. Self-care, especially as women, I think self-care is one of the things that we knock off of our plates very quickly. It almost, I think we hold a lot of guilt as women. Self-care is indulgent, or it's very selfish, or it's frivolous. When in reality, we've all heard that analogy of, if the plane goes down, you have to put the mask on yourself before you can help others. And I think this is the same thing. When we're talking about mental health, you have to be taking care of yourself. You have to be in stable ground. Otherwise, we can't help anybody. We can't look after our families. We can't take care of our kids. We can't take care of our partners. We just can't do that. So self-care is important. I also find, and I think my clinicians would agree with me, in my experience, self-care is something that men are more open to doing, whereas women will be a bit more cautious about doing because they're worried about feeling selfish when they do this. So I guess I should really talk about what self-care is. So self-care is, remember I talked about that container of our coping capacity, our capacity to cope with life. When that container is low, our capacity to cope with things that are going on is low. Self-care will actually help increase that capacity. Self-care is those things that help us feel relaxed, help us feel grounded. For some people, self-care might look like a bubble bath. For other people, self-care might look like just switching off, shutting the doors, opening up a book, and you read a book, right? It's where you can zone the whole world out. For others, for myself, I'm very much an extrovert. For me, self-care actually means I want to increase the amount of socializing I'm doing. It means I've got to increase the amount of fun I'm having with my friends, my girlfriends. And when you're looking at COVID and when there's social isolation, that's not an easy thing to do. One of the things I was talking about with one of my clinicians in supervision just the other day is around when we're looking at self-care, it's about switching off, downtime, being more quieter. However, when we are worried about COVID and we are forced into isolation, self-care might be the opposite. It might be that actually you need to increase a bit more of your socialization. You might need to have more video chats. You might need to have a video party or something, or a virtual party with your friends. Anything that can bring up some of that capacity for you, that can help release some of that stress, that can help you get some more firmer ground under yourself. So with irritability, I would definitely be looking at increasing self-care and trying to figure out what is going on underneath, and so you can look at different areas of your life.
Awesome. Thank you,
I hope that helps.
Speaking of obviously supports and things like that, is there anywhere specifically people are able to get mental health support now that we're all self-isolating, or places are isolating and shut down? So
the question is, speaking of mental health supports, is there anywhere that we can go during isolation to get some mental health support now that we're all isolated?
For sure. Yeah. So you'll be surprised at just how many organizations are offering support, community support. So the first place that obviously I'm going to recommend is Construction Rehab. However, I'm very aware of the fact that we're not open to everybody. Certainly for our members, we offer our services. They're free. No one pays anything. You just come on in, you could give us a call, and we'll set you up with a counsellor and any other services that you need for mental health. Now, for those who aren't members, I've got a whole list of places that you can go to here. For example, there's a provincial website called Mental Health Digital Hub. This provides information and services, education and awareness on mental health. we can get this list up on the BCWITT pages afterwards for sure. There's an organisation called Bounce Back. Again, it's an evidence-based program. This is for youth and adults that are experiencing mild to moderate symptoms of depression, low mood and anxiety specifically. And what their goal is really to teach you skills and provide you with coping mechanisms to deal with some of the issues that people might be going through. There's Mind Health BC, here to help. And again, these are all resources that you can log into, you can access them. During COVID, I believe that most of these organisations are actually starting to do online services for now. Online isn't their usual modality, but they are doing that. And of course, you've got your employee and family assistance programs as well. A quick word about those. Those programs are absolutely fantastic, and they are a great resource to anybody that has those. What I would be mindful of is they are not designed as a model to deal with. Apologies, my camera's shaking away here because there's a train going by my house. The joys of working from home. EFAP. So this is a great resource, but EFAP is very much as a business model designed to deliver short-term resources, and it's fabulous for that, absolutely fabulous. But when you are looking at more long-term mental health issues, so if you're looking at issues to do with say chronic depression versus episodic depression, if you're looking at major depressive disorder, bipolar disorder, any other personality disorder type issues, then we really want to be going for a more longer term care, and that's something that is advised in our best practice guidelines. Very mindful of time here, so I don't want to waffle, but yeah, there's a ton of resources, and again, we can maybe put that list up on the BCCWITT web pages.
Yes, for sure. BCCWITT actually has a lot of stuff in place as well. They've been supporting mental health for a long time just by having staff who's able to answer questions and provide resources. If you haven't noticed on social media, they've been putting out tons of resources and information. We can add this, or I can make sure that that's added to their stuff as well. I know Nina and Lindsay are both on this call right now. Thank you both. And also just providing learning opportunities like mental health first aid. Obviously, there's a pandemic. It's not happening right now. And creating community through their regional Facebook groups and main Facebook groups and things like that. Obviously, there's no meetups at the moment because of the pandemic, but I know that Lindsay was talking about doing some like online kind of meetups kind of thing, and she said that there was a really good turnout and it was really positive. So BCCWITT, of course, again, is also for any women in the trades. It doesn't matter if you're union, non-union, apprentice, journeyman, or anything in between, or journey person, I should say. But yes, please feel free if you have questions or you want any resources or anything like that to reach out to the women at BCCWITT. And Vicky, I know you can't hear me, so sorry.
All right. So is there anything else that either of you want to say before we wrap up? Oh, we've had a last minute question here. Do you feel women are responding differently to this than men?
That's a great question. I don't know that they're responding differently. I don't have the evidence to tell me that women are responding differently to COVID. When we talk about this, I'm presuming that we're talking about COVID. I would say, in my experience, they probably are. My experience will tell me that they probably are, mainly because we tend to take on more as women. I don't know that men would agree with that, but I would say that as women, I feel that we tend to take on more. We tend to step into the caretaker mode very quickly, and so when there's more on your plate, it can be more challenging. So I'm not sure. I think that's a great question, though. I think I'd like to throw that back to the audience actually, and have you guys tell me. And do you find that your the stress is greater for you than other people?
Yes.
Yes.
Yeah.
All right. Is there any other last minute things before we end today's crowdcast?
No, not from me. I hope everybody's enjoyed this, and I hope we can do this more frequently without the technical issues or the trains.
All
That
right.
was awesome.
Thank you.
I think that's it.
Thanks.
Thanks very much, everybody. Thanks for logging in.
Thank you for coming.
Bye-bye.
Have a
Bye.
great day, everyone.
If you liked our video and you want to see more like it, make sure to hit that like button and subscribe to our channel.